On today's episode of the Disability Inclusion Podcast, we speak with France Gélinas, the Nickel Belt NDP MPP, who is the critic for healthcare and vice chair on Standing Committee on Public Accounts. We talked about many different things. She gave us so much time. At this point, my microphone was muted, but I had asked, what are the official duties and responsibilities of the health critic?
Health critic has to be an MPP. So as an MPP, you are there to represent the people from your riding. So you represent them at Queen's Park. You are their voice, but you are also them there to make sure that the program and services of the provincial government are available to them. If you look at my role as a health critic, that means that any program or services that comes from the Ministry of Health, I have a role, I have a say, and I have some level of influence with. Whether it be to organize a campaign so that we get the Ministry of Health to do something or to stop doing something, to do better, to be inclusive of people, no matter their ability or their diagnosis if they are sick, then it's all things that the health critic, myself, can help with.
And I have had some discussion with your office. Your office staff have been very helpful with me in the
Good.
past. Thank you. Um, your biograph on the website says that you're also the vice chair of the Standing Committee on Public Accounts. What exactly is that position?
The Auditor General is an independent officer of the legislature. So what that means is that the Auditor General looks at money that the government has spent and puts a lens on it as to, did we get value for money for what the government has spent? She puts reports forward and showed us, here's how much money was spent, here's what we were supposed to get out of it, and here's what we actually got out of it. Sometimes it's good, sometimes it's not so good. She tends to focus on areas where we could do better and comes with a number of suggestions to do better. What the Committee of Public Accounts does is we look at the report that she has done and ask the government how they're going to change things to do better. So often we will invite the minister, the deputy minister, the program supervisors for whatever areas of government funding she has looked at, and invite them to come and tell us kind of a bit their side of the story. Why is it that this program derails so badly that we spend hundreds of millions of dollars and nothing came of it? And like, are there some systemic barriers? What went on? And then you learn from this, and we make recommendation as a group, as a public accounts group. There are 10 MPPs who sit on public accounts. So together, we make decisions as to directive that we give to the government to change things. And those the government has to respond back. They have to show the changes that they have done. If they're not going to accept those changes, they have to tell us why. And there's a time frame for them to report back and a format in which they have to report back. It's really an opportunity to hold the government to account when it comes to the money that is spent by the government, which is our money, and the outcomes of those spending.
I kind of smirked there because when you were explaining it, all I had going through my head was plate gate.
Yep, yep. Not a wise use of money there.
No.
One of the main things with the Disability Inclusion Podcast is to not only give people more direct access and ask questions that media and that tend to not ask, but it's also helping people understand things they may not. And I've seen a lot of people questioning the NDP and in Ontario and why aren't you doing more? But as your role, you don't form government. So the two things that you just talked about as health critic and standing or vice chair of the standing committee, are you, how much power does that come with at the end of the day? Are you able to like seriously impact things, or is it still you question them and then it's still on the government that the party that's forming government?
So there's no denying that the party that is in government controls the money. When you control the money in our society, you control a lot of the power. This being said, we live in a democracy, and if you can get enough people to speak with one voice and demand change or improvement, it is really hard for a government to say no to that. If there's only you and I who want something, it could be very important and it could get done. But if it's you and I and 10,000 people who sign a petition and 200 people who write to their MPPs and to the premier, and you get a collective of voices coming from different areas, but that demands the same thing, it is really hard for a government to turn that down. What I can tell you is that as a MPP in opposition, I play my role by making sure that I help amplify the voice of people who want change. And this is what we do. I would say, are we successful? I would say yes, but I don't give people false hope. It's not because you come to see me with a good idea that that idea will become reality and be acted upon. But I can tell you that a lot of times the changes that we have now is because a person came to see me, we sat down together, we realized that what she was bringing forward made a lot of sense and worked on it to make sure that there was enough voices wanting this that it became reality.
With that, can I ask, when you get people who maybe are either attacking or aggressive or something like that, how can they actually switch from being upset because you're amplifying voices? What can they do differently to, if they're frustrated about something, what's a more productive way to express their disappointment in a situation, not with you, but with the situation? Because I'm assuming you see it more as disappointment, people showing disappointment maybe in you or your position when they're actually upset about the current situation.
I would say a lot of it goes with the job, as in, people live their lives. They come in contact with programs and services from the provincial government. Things don't go the way they had hoped or the way they expected it to go. So, they'll start on their own. They'll talk to the people or the service. They'll try. And once everything else fail, then somebody someplace will say, well, maybe you should go see your MPP about this. So most people who come to see me come because they've tried really hard to fix something that irked them and couldn't. So we're kind of at the end of the line. We're very seldom the first line of complaints. Where once they've made complaints, they didn't get resolution, it grew, and then they end up in our office. So I would say it's part of the job. I let them vent. What is it? And then I never give false hope, but I try to show them, here's, if we change this, then it would achieve your end goal. And I really try to help them. What is your end goal? Is your end goal something for you? Is your end goal something to change the world? What is your end goal? And then let's see what we can do together to achieve this. And it usually works. People will think back as to what they can and cannot do. What is it that they really want? And what is it that just I cannot change the past. Nobody can do this, but we can certainly influence the futures together.
can ask your question, sir, because I went off
Off
the list.
base.
Sorry.
um, the dietary information on menus has been very beneficial in my own life and with my family. My mom and sister are both diabetic. So I just was wondering what was the inspiration for the healthy decisions for healthy eating private member bill that you put forward?
So menu labeling is what it's called. So now when you go to any big chain restaurant, you see the item, you see the price, and you see the number of calories. So this came again, a very nice person come to see me and say she had a health issue for which she needed that information. That information was available, but she needed to ask for the menu before she, like you would go. Sometimes that information was on a poster on your way to the bathroom, not exactly convenient to make
Yeah.
healthy choices. And then I said, okay, started to talk a little bit about this to people who know dietitians and those kind of people. I'm a politician. I'm not a dietetic expert by any stretch of the imagination. But then you start to talk to other people and say, what can we do to help her? Realize that at the time that I first started, the state of New York, no, the city of New York had just changed to menu labeling. And a little bit of data was coming from this because it was being analyzed as it was being done. And then, as I said, we grew the circle. It started with a petition, it started with letter writing, it started with reaching out, and we did a few polls to see are Ontarian open to this idea. I presented it in the House, and the first time I presented it, there was the the gallery, the visitors gallery on the opposite side of me was packed with everybody having their little Harvey's logo and A&W logo and everything else. And if eyes could kill, I would not be there no more. Because they were not happy with what I had to say. But the people were. And so went back, worked with the industry, worked with the different partners to say, what could we do? And basically saw an opportunity when the government, it was a liberal government at the time, was in deep trouble, needed to change the channel, and used the calorie labeling bill to change the channel. At the end, keep your eyes on your end goal. What was the end goal? The end goal is that we get calorie labelings in big restaurants so that we can help people who need that information. But it also had a lot to do with the obesity epidemics within our children, and found that more and more of us eat restaurant food. And when people had the information in front of them, especially for parents, 1 in 2 parents use that information on the menu board to make informed decisions for their children. When it is not there on the menu board, 1 in 1,000 uses
Yeah.
that information to make informed decision. So as you grow the tent, as more and more people look at this issue, it became a important enough issue that it is now the law in Ontario, and everywhere you go, that information is available to you.
Hopefully, with the change in life through the pandemic, more people are going to be cooking at home, or at least more aware of what they're consuming because they've looked at a lot more recipes over the last little bit than ever. So when they go back to going out more often, they'll be more aware what they're consuming.
Oh, absolutely. And just when we did the calorie labeling, a lot of restaurants actually changed their preparation. I will always remember, I like Subways, I like the tuna melt. And when I saw how many calories there was in the tuna melt, I never had it again. Like 1,500 calories, like this is more than what I need in the day, but I need more than a sandwich to get me through. And once the calorie labeling came, they changed their preparation. The same sandwich now is made with 750 calorie, not 2000 anymore. And lots of restaurants did the same. They changed their recipes because once people saw how many empty calories there was in their food, they didn't buy it anymore.
Yeah.
Have you noticed? w- You said that the whole gallery, visitor gallery, was full of people who were opposed to what you were doing, but then it turns out there's this huge positive impact, not just for the businesses, but for people as well. Do you notice in a lot of times where there's something you're trying to do and the outcome is going to be good and positive, but there's still massive resistance and does the resistance exist because they don't want to have to adapt or because they truly think it has some kind of negative impact?
I would say a bit of both. In my line of work, I call it the human effect. We are all human beings, and human beings are sort of pre-programmed to not like change.
Mm-hmm.
So this is the kind of beast that we are. We don't like change, and that's the way we behave. And it requires an effort to understand why should I change. It requires an effort to change. So all of this has to be taken into account. With the calorie labeling, I did sit down with the industry. I did sit down with A&W and Harvey's and Subways and all of those people to really make them realize this is coming. This is what people want. What do you need to be successful in this change? So they are not the enemy. We are all part of this. As long as you respect people, I mean, don't get me wrong, I do a lot of things that is very detrimental to the profit margin of the tobacco industry. They know me, I know them. Um, we will never be friends. Let's just be clear. But I can still respect them enough to hear their point of view and agree to disagree. I will never agree to anything that encourages people to smoke. There's nothing healthy into smoking. But I will respect the fact that we have millions of people in Ontario that are addicted to nicotine, and that it will require a lot of work to help those people quit their addiction.
You've represented the Nickel Belt for over 10 years. Is it 15 years you've been doing it?
Over
Thir-
15.
13 years. I was
13
13.
elected
years.
in 2007.
What other roles have you had, and what has been the hardest day you've had in office?
Oh, I've had many other roles. I mean, I was on the select committee for mental health and addiction. I was critic for Mind, critic for Francophone affairs, critic for health promotion when we had a health promotion ministry. I was, I've been on many, many different committees and parliamentary roles. I'm the president of the Francophone Associations of Parliamentarians. I have many roles as MPP. The toughest day in this job has been they were a very nice man who was in one nursing home, and his wife was in another nursing home, both of them in my city, in my riding. So one was at Finlandia Coty, the other one was at Pioneer Manor. And the wife had Alzheimer, and her dementia was progressing. The husband would call the CCAC at the time every day to know where his wife was on the list so they could be reunited. They reached out to my office. I helped them to get reunited, and she passed away the day that we got the okay.
Oh,
And that was just
Heartbreaking.
wrenching. He was a very nice man, loved his wife, did everything to help her, and the outcome was not what we wanted. It was just really, really sad.
Yeah. Um, both Jay and I are advocates, so we're just wondering how can advocates best work with your office to ensure advancement of our platforms and to work towards real change.
So we at the NDP we work from the grassroots. So I am but one voice in my party, no more, no less. Everybody who belongs to the NDP has a voice. We all have an equal voice. So if if this is something that is a party position, then the best way to push this forward is really to get your writing associations to put emotions forward, reach out to other writing associations who may want to support your motion, bring it to provincial council, have it debated so that every writing association has a chance to look at what they like, what they don't like, what they would like tweak. What does it mean for First Nations in remote community versus uh, Toronto high-rise dwellers, or what does it mean for racialized people, francophone, whatever, whatever. This is what our party's all about. And once it gets debated and adopted by our party as a whole, as a provincial council, then it becomes an NDP position and then it can be pushed. But through this process, I am but one voice. Everybody in the NDP is equal.
That's amazing that you went into that detail because one of the things that I've been trying to do over the last year is try and show people that I'm sorry, the best way I can explain it is at the start of the year I was Twitter bitching. I was just on there angry and sending you do this. And then I started learning that there's a better way to go about connecting and well, what I learned has led me to this conversation right now with you. And I've learned that politicians are not only really accessible, at least the NDP are very accessible, and I've had many talks, and it's just trying to show people that even though their issue is their issue, it still affects many people. So you just laid out the absolute perfect, well, the absolute definitive path of how to go from advocate to change. So thank you very much for that.
Yeah.
Um,
You're welcome.
you entered, and this is very important because I'm in Glengarry Prescott Russell, so it is a large francophone community. And you had introduced the private members bill for mandating a fully French language university. And at this point, it's currently, I don't know if it's on pause or if it's canceled, but can you talk about how or why that's so important?
Oh, absolutely. So you will go back to Regulation 17 at the turn of the 1900, in 1912 to be precise. The government of Ontario passed a law that made education in French illegal. So for till 1912 to 1927, it was called Regulation 17, the Règlement 17, and it was illegal to teach French or in the French language in Ontario. At the time, um, it was really, really difficult, uh, but Francophone survived, the language survived, and they managed. It was not till the 1960s that Francophone schools started to be publicly funded, because before the church got involved and private money got involved so that Francophone kids could continue to speak their language in school and all this. Beginning of the 60s, um, uh, public French school started to get funded. Then the French schools were under English board. So the English boards was supposed to make the best decisions for Francophone school. So in the people of my generation, our parents pushed really hard so that we would get our own school boards and that we would get our own schools. So elementary and secondary school that are for Francophone and managed by Francophones through the French boards. Then fast forward, and then in the 90s, the same. So people who grew up going through kindergartens all the way to grade 12 or grade 13 at the time, that doesn't exist, but it used to, um, wanted to go to college in French. I mean, they had done their entire education in French and wanted to go to college in French. So we got the French college, La Cité Collégiale in Ottawa. We got Boreal, and we also had a French college in Toronto that got folded in some years later. And now the young people who have gone through their entire education are pushing for the same thing at the university level. They want to be able, no matter where you are in Ontario, if you're a Franco-Ontarian, you should be able to go to university in French. They did a tremendous amount of work, held white, wrote white paper, held provincial conferences, and made it clear that they wanted a French university that would serve people no matter where they were in Ontario, and that would be governed by Francophone for Francophone, like we did for the primary and secondary school, like we did for the colleges and all of that. The just before the Liberals got booted out, they finally agree to pass this bill that created the Francophone University with $0 attached to it. When the new Ford conservative government was elected, you will remember October of 2018, right after they got elected, came out with cancellation of the Francophone University, as well as cancellation of French language commissioner. Uh, the feds at the time agreed to fund the university, the Francophone University. So the federal government agreed to do that. The Ford government refused, and finally last summer, no, the summer before, accepted to have the federal government fund 100% of the university, the new Francophone University, for the first 5 years, and with one campus located in Toronto. So apparently we're supposed to say thank you to Mr. Ford for agreeing to let the feds fund the university, the French university in Ontario. This is in their big heart. They have agreed to let the federal government fund that university in Ontario. So the university is slowly but surely getting off the ground, uh, with one campus located in Toronto, with very no contact with the other universities that offer French programs or anything like this. So not the vision that the people of Ontario wanted. The people of Ontario wanted, no matter where you are in Ontario, you should be able to connect. And none of this has been done, but the federal government is paying for a small campus in Toronto to welcome a few programs. I think if with COVID, it's hard to say what has derailed, but if everything goes well, in the fall of 2022, they should be able to have their first students for a few programs.
Is there hopes that there will be one big university, or is the current compromise a bunch of campuses throughout Ontario?
None of that work has been done. So we don't know what it will look like. Right now, all we have is a small French university downtown Toronto. Not what we've ever asked for, but this is what we got, and funded 100% by the federal government.
For
So then, when the NDP get their majority in 2022, they can do it right.
They can do it right, and doing it right means let's connect with the community. Let's connect with the Francophone to make sure that what makes sense, what are the programs that they want, how do they want them delivered, what would make sense to people living in Hearst as much as people living in Cornwall, as much as people living in Windsor. What would make sense to all of us?
for me, my daughter's mom and her entire family is full French.
Yeah.
So we're raising her to be as balanced in her knowledge and understanding and her connection to her cultures and pasts and stuff. And when in Glengarry, Prescott, Russell, they were organizing protests when the announcement came that it was being potentially canceled. And
It
I was
was canceled for almost a year.
well, the when the protests were happening, it's when it was potentially going to happen, and people were going out to try and stop it. And I didn't know that that was not actually a thing. That at some point there's no more French um, controlled education, which to me, if my daughter wants to go when she comes to that point, if she wants to go and continue um, in French to learn, that should be an option because it's first off, it's one of the two official languages. So to not have that offered kind of goes against the whole meaning of, from what I understand, the French language or the Official Languages Act, I think is what it's called, where you're
That's at the
actually
federal level. At the provincial level, it's the French Language Services Act, but
Services Act,
same difference.
but yet they're not providing the resources to have a university that falls under that, which to me that kind of was a shock to find out all of that because I didn't fully understand at the time. And I also didn't know about the deeper history of it that you just explained about the past of it, which is something that's not taught. And these are things that we're starting to learn a lot more with a lot of Canadian history. There's a lot of things that we aren't taught because
Yeah.
when you explained the history of it and that it was illegal to teach in French and what the implications of that are, they were basically trying to get rid of French in Canada. That's not something I've ever known. I'm almost 40 and I've never been presented that, and that's part of our culture and or our history, and it's something that needs to be taught. And that's why it's important that French language or uh, French control how French is taught. I don't know how to properly express this part
No, me
of it,
neither.
but
It goes better in French. Only francophone. For and by francophone is how
yes.
we say it in French. Pour et par les francophones. In English, it would be for and by francophone, but it doesn't sound as good.
Not much sounds very good when it's not en français. In the upcoming answer, France has referred to the disabled community and disabilities as handicap, which may offend some people, but in French it is a non-demeaning proper term. So just a bit of a heads up. I was wondering, I don't know if this is attached to health. To me, it should be, but I just wanted to know, in Ontario, the disabled community is a protected class, and I was wondering who is supposed to protect us and from what? Is that part of health?
No, not at all. So think about the healthcare system is there when you are sick. Having a handicap, you can be perfectly healthy and have a handicap. So people with disability falls under the Ministry of People with Disability. And there are a number of programs specifically to help people with disability, but they only interact with the healthcare system when they are sick or in need of surgery, which is a very small part of their lives.
When you say surgery, that's something else. We just had the Ford collection of unmasked people yesterday giving Ontario a heads up that they're locking down after the busy season. And they keep, throughout the whole pandemic, they've been using surgeries and procedures as kind of a warning like, listen, we're getting close to having to stop procedures and stop surgeries to try and get people to I'm going to say smarten up with how they've been um, going about handling the pandemic. How come, or I don't know if it's how come it hasn't, or has there been discussion about designating certain hospitals that can continue these? Because we have a lot of talk that next year is going to be still affected by COVID. So is there any potential to having designated hospitals to maintain being able to do surgeries and procedures?
Yes to all of this. Most hospital already have referral pattern. So you take your big community hospital, they will have linkages to tertiary, to specialized hospital throughout. So whenever something happens within the healthcare system, it does not happen just in one hospital. It happens to a network of hospital who tends to work together. So if we look at what's going on in Toronto right now, in Peel and in York, where there is a ton of people that have the virus, a lot of them that are sick, a lot of them that are in intensive care. So William Hostler Hospital got overwhelmed. Their ICUs are full, their ventilators are full. They started to transfer through all of the big hospitals in Toronto. So think about University Health Network, think about Toronto General, and all of this. So once they were full, they went to this. Once the Toronto ICU and respirators were full, they stretched it out to Hamilton and et cetera, et cetera. So yes, hospital. Meanwhile, where I live here in Sudbury, we continue to put out people at 110% surgery. The surgical capacity has been increased to include on weekends and at night, and people go in for their surgery at crazy hours and crazy days, but we're getting them done because there are very few cases in Northern Ontario. So this is already happening, but we still need in Northern Ontario to maintain about 10% capacity so that if the virus comes to Northern Ontario, we are ready. So the hospitals of Northern Ontario pool their resources together. They say HSN, which is the hospital in Sudbury, you do all the surgery at 110% right now, while other hospitals sits with vacant ICU beds so that if somebody gets sick. So this networking between hospital already exists and is already there. But you have to realize that we did not come into the pandemic with a perfectly well-oiled hospital machine. 50% of our big community hospital were operating at over 100% capacity, some of them for years. So we came into the pandemic with long wait lists for surgery, long wait lists for procedures, and hospital where, like mine, where you have 431 bed and an average of 520 people. So that means 90 of them sick enough to be admitted into the hospital will be admitted into a hallway, a TV room, a bathroom, the end of a hallway, just about anywhere you can fit a bed, which is often leads to really, really unpleasant hospital stay for people because it's not fun to be put in a TV room with 11 other people that are sick. It's not fun to be in a bathroom with no call bells and no place to walk around your bed. It is really tough. And this was happening in half of our hospital before COVID. So when COVID came on March 16, they canceled all surgical procedures to make room in our hospitals that were overfilled. So people that had already been waiting a long time for their surgery were put on pause, not knowing when it would ever happen. And now the surgical backlog is very high. It was last time I checked, it's close to 160,000 people that are on the backlog of surgery.
You've been the health critic for a long time, so I'm gonna ask this based on your experience, because I know that you may not necessarily know the specifics, but it is one of the main factors to the wait times in that because ERs fill up with mental health patients looking for help and the disabled community and stuff like that. Is it because OHIP isn't expansive enough or Ontario doesn't provide enough supports, or is it strictly a funding issue? We've come to a point where we're too many people for the amount of hospitals. Is there any kind of discussion like that that you know of?
Oh, absolutely. So when people think about Medicare, I don't know what they have in mind, but I can tell you what Medicare really is. Medicare is when you go see a physician, you won't be charged. When you go to a hospital, you won't be charged. Everything else that we have in our healthcare system, long-term care, mental health, it doesn't matter. Everything else, home care in our healthcare system is not part of Medicare. It is a patchwork of services that sometimes work good, sometimes don't, and sometimes are atrocious. So for any other parts of our healthcare system that lets us down, our hospital is what I call like the net of last resort. It is a net that catches us all, that makes sure that we don't fall through. But if we had better home care, a whole lot of frail elderly people would never end up in the hospital, will never end up needing long-term care. Why? Because we supported them respectfully where they want to be in their own home. If we had better program like supervised consumption site for people with addiction, there would be, again, there would be a lot of people who would be helped with their addiction, with their mental illness, but this is not there. So we all end up in the same place. We end up in our hospital, which is part of Medicare, which catches us all. So is the solution simply build more hospital bed? No. The solution is fix our broken home care system, make sure we have a good, strong, robust mental health and addiction system. I was on the select committee for mental health and addiction. We know that we are failing those people, yet we know how to help them, but that help is not available to them, has an 18 months wait list. Well, an 18 months wait list, the family will have fallen apart. The child will be grown up, and anyway, all sorts of stuff happen in a year and a half. You would never tolerate this for other life altering problem, but we do in mental health and addiction. So is the solution just to build more beds? No, the solution is really to look at how do we support people with different problems and diseases where they are. And that means strong and robust home care system where it's not um, basically a place for big American corporations to come and make a whole bunch of money off the back of sick people. Same thing with our long-term care system. Ontario is the only one where most of our beds are owned by big multi um, uh, country,
Conglomerate.
yeah, a conglomerate that are there to make hundreds of millions of dollars off of the back of frail elderly people. Same thing with mental health. How could it be that a child with a mental illness in Sudbury will be put on an 18-month wait list before he or she can receive any help? This isn't, we would not tolerate this on any other part, but the discrimination against mental health of people with mental health and addiction is live and well. So, and it goes on and on. So there are other parts of our healthcare system that fails, which is a huge part of why our hospitals are full.
Do you think the pandemic should have woken up a lot of people to the realities of what you just said? That healthcare isn't what it could or should be. The overall healthcare, the mental health, addictions, all these supports. Do you think that there's any chance in your heart you think that can change with a liberal or a conservative party? Because that does not seem like that is their overall goal is not to support what you just said.
I would tell you that when the army forces wrote their report and showed the cockroaches, showed the food that was not fit for human being, showed the people covered in bed sore because they had not been moved, showed the horrific conditions in our long-term care home. Ontarians showed that they had a heart and decided that this is not acceptable and this has to change. And there was enough pressure on a conservative government that they agreed to take one of the NDP positions that I had been pushing since 2016 or even before this, 4 hours of hands-on care. So I would say for long-term care, I have a little wee bit of hope that things will improve, but the conservatives being who they are, not till 2025. Ugh, people need help now. But for the rest of them, for home care, for addictions, for mental health, for children, uh, I have, I will continue to work really, really hard, but I don't give people false hope. With the government we have now, who is sitting on $12 billion of COVID money, but refuses to do screening in our school, refuses to have isolations um, places for people who cannot isolate at home, refuses to pay for sick days. I don't give people false hope.
You're a part of the government. You're not in the party that's forming government, but you're in the government. Do
The
you
official uh,
Opposition.
the question I'm trying to ask is, because you are part of the government, you've been a part of it for so long. When there's a government like the one in place right now that's just not doing enough and people are suffering, does that weigh on you, or do you feel,
are you able to compartmentalize?
yeah, are you able to go home knowing you fought to try and get them to do the right thing? Or is it like, how do you
Oh
deal
yeah,
with that?
absolutely. I try my best. I know that I have given it everything I have, and that's all I can. So I know that I know the issues that are important to people. I know the issues that I'm willing to able to help, and I'm always willing to help. So if I'm able to, I will help you. If I'm not able, I'm not going to give you false hope. And if there's hope in between, I will be there with you. So no, I have. I'm the job of an MPP is never done, always continues, but I have no problem celebrating the small victory. If I'm able to get two people who've lived together for 70 years back together, I'm having a good day.
Thank you so very much for taking the time to do this and for everything you have been doing.
I
You're
love your
welcome.
artwork.
Oh, well, thank you.
We'd like to thank France Gélinas for joining us today on the Disability Inclusion Podcast and for sharing such valuable knowledge with us. It is great to have learned the steps that would be needed to raise an issue or change policy. In the hour that Jay and I spent with her, it became very evident that why she has been an MPP for Nickel Belt for 13 years. She cares about the job and her constituents. She is the type of MPP that I would strive to be and would want. Thank you. Have a good day and stay safe.